So this is all prevention, tools to help prevent disease by taking care of our patients that present with lung yin deficiency and lung yang deficiency. So now looking at fullness in the lungs, the first common in flu season and epidemics, as you know, is wind-cold penetration. So the anatomical jing of the lungs at the epidermis, remember, controls and regulates the Wei Qi at the exterior, our defensive energy, and our immune system. So when the defensive layer, the Wei, is deficient, whether lung Qi deficiency or Wei Qi deficiency, the epidermis barrier is fragile and vulnerable to the exterior influences, whether cold, heat, or dampness, which can penetrate. When an enemy attacks, you have to know what type of enemy. And there's several varieties of viruses and bacteria, but the ancients during cold climates said that when cold attacks our organism, it attacks according to the 6 great meridians. Cold is static and it moves by an energy wind. So the ancients described the enemy of wind cold. So if you're attacked by cold at the skin, you have the body hairs, sebaceous glands, sudoriferous sweat glands, and the sub-low vessels coming from the tendinomuscular meridians or the sinew channels, which you know is a secondary meridian starting at the Jing well point of the principal meridians. For example, Tai Yong is the most superficial, and it's nourishing the tendons, ligaments, and muscles and nerves along the TMM pathway with yin. So from the muscle layer, they have these small sub-low vessels branching off the tendinomuscular meridian, going through the dermis, epidermis, sebaceous glands to the skin to protect the body from the external perverse energy. So they are also involved with protecting from wind-cold penetration. And of course, when we're healthy, if our lungs and our mental and our Wei Qi are all strong, then the skin does its job, and the mucus lining in the nose that contacts the air will reject the wind cold, the ancients called it, from penetrating. Our own glass of yin and yang is full. We're in harmony with nature, but if our glass is deficient in yin, then that cold can penetrate. And the body hairs do their job to raise and call the Wei Qi to come and protect from attack. But if we're unhealthy, if the Wei energy is weak, the lungs are deficient, or too many intense emotions, then the wind cold can easily penetrate via the skin, the mouth, remember the larynx, or the nose. All these relate to the lungs. And once it has penetrated, and it is from external and not a part of us, it becomes an enemy. And however, if the lungs are strong, it will work to repel. So at the skin, the body hairs raise, like I said, calling the Wei Qi to come and help. But if the Wei is not being maintained by the anatomical jing of the lungs are weak, the Wei may arrive, but it may not be strong enough to fight. And then the Wei can close the cutaneous gates. One of the Wei functions is to control the cutaneous pores, the openings and closings of the sudorific or the sweat glands. But here it's not strong enough to open the pores and trigger sweating. And now the wind cold is penetrated, becoming a perverse energy, and it can't get out. It's trapped at the level of the epidermis. If the lungs are really weak, it'll penetrate to the lungs. Its goal is to be itself, which is cold. And if we are deficient in our own internal cold, it will attack the lungs and then the kidneys. But most often the lungs are maybe weak, the wind cold is penetrated, but they're strong enough to attempt to release the exterior, the wind cold, that wants to penetrate to the lungs, to the Qi level. But the wind cold has to go somewhere. So the lungs are strong enough to push this wind cold energy at the skin, penetrating to a more superficial external level, the lungs or the nose. And I first learned this in 2000, and I probably use it about every day in the clinic, which is understanding the pathway that this wind cold takes when it penetrates our organism. So the lungs are strong enough to protect itself from the cold. It pushes it from the skin toward the nose. or it could have penetrated via the nose or the mouth. And the wind cold wants to go to the organ, the headquarters, the lungs, but the lungs, like I said, push it to the nose. And the patient presents with nasal congestion and a runny nose, rhinorrhea. Now, if the wind cold progresses, and so here, if this is the symptoms of the patient, in addition to the treatment to eliminate the wind cold penetration, we want to add the point, large intestine 20. And you know that point. But if we don't treat, or if we don't treat well and it progresses up to the Tai Yong, remember the most superficial level, and it can go up to bladder 1. So there's an internal branch. The Yang Ming detests heat, and from large intestine 20, it doesn't go directly to stomach 1. It goes first to bladder 1, the Tai Yong, water, and then to stomach 1. So here we are at the Tai Yong. It's the most superficial, protecting the interior and the organs and the lungs. And we've deviated the perverse energy to the superficial level, the Tai Yong. But if the enemies, and the key sign here, I think it's on your next slide, is tearing and watery eyes. So if the wind cold is penetrated and that's what the patient is presenting with, you want to choose bladder 1. Very often they're sneezing, and that's the key sign, especially in allergies. And here it has progressed to bladder 2, following along the Tai Yong pathway, and the patient's sneezing sometimes 100 times a day. And if it continues, so then you add bladder 2, if that is the key sign where it's progressed to. And then if it continues along the Tai Yong to frontal headache, they can have frontal headaches and sneezing, teary, runny nose, and you ask them where the head hurts, and it's right in the front. And then you can tell that the evolution of the perverse energy has reached here, and there's points that you can choose. For example, there's a technique called removing obstruction from the sky, which is from governing vessel 24, a half a sun into the hairline. And in the text, they say to thread the needle to governing vessel 20. The Dumai is the biggest meridian of water. And so you're bringing water to the head, which is an excellent point for calming the mental. Or you could do bladder 4, where from stomach 8 to governing vessel 24, if you divide it in 3, 1/3 from the midline is bladder 4, and you can direct that back to, they say, to bladder 7, because if this progresses, there's an internal branch from bladder 7 at the top of the head, and from bladder 7, it can go to governing vessel 20. So here it's still following the Tai Yong, but knowing the internal branch, the risk is if it goes to the top of the head, then the patient can have vertex headaches, and it can get more serious because there's an internal branch from the governing vessel that goes to the vestibular coccular zone. And if that happens, then there can be a headache on the whole head, but there can also be worse symptoms like tinnitus or ringing in the ears, vertigo, and heaviness in the head. And so then you can add the point here, if it's the top of the head or the whole head, you can add bladder 7 and governing vessel 20 and gallbladder 8 just above the apex of the ear, about 1.5 sun, where it's tender. And you can actually thread that point down to Sanjiao 20, located right at the top of the ear. But if we haven't treated it, then it can progress following the Tai Yong meridian and go to bladder 10. And their symptoms here can be pain and stiffness in the neck. So sneezing, runny nose, heavy head, dizzy, ringing in the ears. This is the progression of wind cold penetration in the Tai Yong. And here from bladder 10, it's important to note there's an internal branch coming from the governing vessel. You know the governing vessel, and there's a longitudinal low branch coming from governing vessel 1 that goes along the spine up to governing vessel 16 and penetrates into the brain. And from there, there's internal branches that connect with bladder 10, gallbladder 20, Sanjiao 16. And so these points you can all consider, like Du 16 is and Sanjiao 16, as window of the sky points to help to reconnect the head to the rest of the body. And so you can needle all these points if a patient has stiffness in the neck and the penetration into the brain, the patient risks meningitis here. If it continues and we haven't treated and it follows the Tai Yong pathway, it goes from bladder 10 to governing vessel 16 to governing vessel 14 to 13 to bladder 11. At some point we have to study all these internal branches, and it goes all the way down to bladder 23, the back shoe point, and then it can penetrate into the kidneys. And the patient can have low back pain, they can be bent forward, and it's still external though, it's still along the Tai Yong pathway. And so this is what we call Tai Yong Syndrome, which is the penetration of Wen cold. So at this level, it's annoying, but we really can treat it. And if we don't, then it can penetrate further and get a lot more serious. So the texts insist that we treat it at the level of Tai Yong, the most superficial level, as when it penetrates, the enemy gets stronger. And when an external energy penetrates and gets stronger, we get weaker. So it always comes back to prevention and then treat things at the earliest stages. Because here we want to protect it from attacking the organs, the Qi level, the lungs. As you know, it can progress to bronchitis or pneumonia, or it can attack the kidneys directly, causing cystitis.